This is William Tincup and Ryan Leary, and you are listening to the Practitioners Corner podcast. We are broadcasting live from Cornerstone Connect in Orlando, and we've got John on today, and we're going to be talking about Orlando Health and his journey.
Which is based in Orlando.
It is, yep. This is good, Ryan. I'm glad we clarified that. Although they do have a Tampa business too,
Yes.
So expanding. So, John, do us a favor and introduce yourself. Tell us a little bit about you.
Sure. My name is John Murray III. I've been in the Orlando area off and on for 20, 30 years. I joined Orlando Health probably about 3 years ago. And when I joined them, I said, hey, you know what? I want to step back a little bit about what I'm doing. And I took a break from being a director or higher, and I decided I just want to make a good effort for the organization. That lasted about 3 months, and I probably opened my mouth a little bit more than I should as far as, hey, we could do this, and there's just so much excitement and so much energy there. I came into my current role as a senior director of HRS, analytics,
Right.
and learning systems and design, where I lead some great teams that are full of energetic people looking for ways to improve the organization, but also make sure that there's data integrity, and the learning process is more of a complete story where we issue best practices and make sure the organization moves forward, not stays where they are. As we look to grow the organization, as you mentioned, we're in Orlando, but we're expanding. We have hospitals in Tampa and all up and down the I-4 corridor. We need that type of mentality. We need those individuals that are looking to make a difference, but also looking to do things a little differently than you would traditionally do in a hospital or healthcare organization.
How has learning changed throughout your career and now? I mean, you've seen things that could have been changed at Orlando Health. You didn't have any expectations of being in the director's role. What has changed, and what kind of made you say, yeah, we need to do better?
There's so much that have changed. When I first started in education or training, it was back before we had most of the technology we do today. And the scary part is that I don't know how we could do without it, but our interactive engagements was we were playing board games, or we were we were filling out crossword puzzles or whatnot. Those have a really good place, but as we moved up from a just general technology perspective, we had to rely on that more, to where the classroom was a way to intermix and to build relationships. The content really can be had anywhere within the organization. So when we look at systems, when we look at tools, each one of those tools has to really connect with the learner. We have to make sure that the content is connected to the learner as well. And that was something that people weren't really thinking about before. They were just thinking about, well, I have to check a box. We're going to cover these 10 topics and then move forward from there. And what we saw is that while we had, okay, that's great, the people love the trainers, the content fell short. And when we started to measure whether or not it was successful for people applying it, what we saw is that they were only applying about 30% 60 days after the training. So we had to go out and reinforce information. We had to change some of the process. What we have today, especially at Orlando Health, is we have a way to not only make training engaging with some of the new interactive tools from an electronic standpoint, but also we take all of that relationship building and put it back into the operations so that they don't miss it when they leave the training environment and go back to their operations.
Like it really sticks.
Yes.
Yeah, I can see that. All right, let's go, John, with your career. Let's go backwards in time. Let's go maybe back to high school or college. What did you want to be when you grew up?
Yeah, the funny thing is I still am not doing it.
Formula One driver?
Yeah, well, no, I actually wanted to work for Jim Henson as a company. So,
100%.
Yeah,
Okay.
so I used to do voices, and I used to do some puppetry, and
Oh, yeah?
I never ended up doing that because the career went the other way. So as I graduated high school, Jim Henson passed away down here in Florida, right down the street.
Way too early, too.
It's true. Yeah. And this documentary that's out now with Ron Howard,
Yep.
just a great piece. But he was a big influence for me, and so was Walt Disney.
Yep.
So I said, you know what, I'm going to go into teaching. So I went into teaching, and I said, well, I can't teach yet. I got to do stuff that I really need to do and make a career out of it. So I said, what else do I want to do? The Henson Company was reforming at the time. Wasn't the right place. So I came down to Walt Disney World. And I spent about 20 years at the Walt Disney Company. I said I wanted something different because I had an education in English education. I taught English in high school for a while.
Right.
I also have a degree in psychology. And I said, I just want to do something different. And they said, well, what about costuming? So I don't know anything about costumes. How can I learn it? Can I learn it while I'm here? And they said, sure. And I said, okay, so let's do that. So I spent a couple of years in costuming and was a costuming manager for a while.
What is costuming?
It's where they make sure that everyone in the park has a different theme
Right.
when it comes to what they wear and where they wear it in the park. So if you go to the Magic Kingdom, if you're in Fantasyland, you'll have a different outfit
That's right.
than they do in Tomorrowland.
Right.
I was at the Disney MGM Studios at the time, now Disney Hollywood Studios, and one of the shows that I got to lead was Indiana Jones Epic Stunt Theater, which was great. So I
like
got to
that
choose
show.
shoes for the tumblers. I was also a huge fan of the franchise. So
Right.
I was so excited just to be there, but then I got to lead the team that did that. I got to learn about gussets and hems and all this other stuff that they don't teach
That
in,
is so
in school.
different than where you came from.
Yes, and so different than where I wanted to be. But it was at Walt Disney World, and it was at a place that was growing and looking for the energy of everyone that works there, so that you can pass it on to the guests.
Right.
Yeah.
Right. Everything's about the guest having a fantastic experience.
Exactly.
And Walt Disney, they don't believe in like employees. I think everyone's a cast
cast
member.
member.
Yeah.
Right. Everyone's a cast member.
Yeah, and it has been wonderful to see them grow and change over the years because it was just parks and resorts.
Right.
Then they expanded past that into TV, where they bought ABC, ESPN.
Oh yeah.
Gotten to travel and do a lot of things when I
Cruises.
used to work for them. Exactly.
Yeah.
But they have the same message. It's
Right.
where magic lives. It's about creating that energy and creating that excitement.
Does magic live with the employees though, with the cast members?
When I worked there full time, it did. It was part of the culture.
Yeah.
That's why you were there.
Yeah. Right.
Sometimes you weren't you didn't have the highest skill, but you can do the job very well because of your passion for the company and the message
It makes
that it
up
was
for
sending.
their capabilities.
Exactly.
Yeah, I worked at Walmart early on, like
Yep.
in the 80s, and it was the same thing. Like you believed in Sam Walton.
That's
you
right.
believed in it. Whether or not you were capable or not, well, we'll fix that.
Right. And the Walt Disney Company had a great training program and great training plan.
Oh,
so
really?
when we started implementing a learning management system there and we started moving things into a central to local environment, we wanted to make sure that everyone understood not only the vision and mission, but how they played a part in the show. When you look at their 4 key values, it's now 5. It's safety, courtesy, show, and efficiency. Now it's inclusion as well, so that everybody knows their place in the show, but also the importance of connecting back to everyone and making sure everyone can deliver on excellence.
You're referring to it as show. That's I understand why.
Yes.
But I never thought of it that way. I've never heard anybody say your part in the show.
Well,
Not specific to Disney.
Yeah, but
It is, yeah.
And Disney doesn't put a lot out there about how they do things.
No,
it's again
Yeah.
similar to Walmart. We wouldn't talk to other people about how Walmart works.
I'm just assuming Disney is the gold standard in everything we're talking about, from agility to learning to systems to everything. I could be very wrong.
Well, and the fun thing about that is that when you draw that line, you have to live up to it.
Right.
So what happened in the organization is that was the mantra for moving forward is, listen, everybody else expects us to be this good.
Yeah.
What are we going to do to maintain that?
Right.
So everybody would chip in and make some changes. When I was there, we had mostly classroom training. And what we had to do is take
Right.
industry standards and processes and convert them into the messages that the organization was sending. However, as we started to move into e-learning and move into, it was called CBTs back then. You remember you used to put that little disc and coaster into the
100%.
drive. We had that too. And with each of those technologies, each of those learning experiences, we had to connect the cast back to why they were doing it.
Yeah.
And we put it at each of their jobs so that they can connect, but also tell us what they wanted. The stories of each of the executives. My wife and I both worked in training at Disney, and what we would hear from each of the executives, they each had their own path.
Oh, yeah.
And how they would move forward, they would tell the cast what their path was so that they understood there's not just one way to get to here. You can go multiple ways, and it's up to you to make the difference. Your development is up to you, but we'll provide you the tools in which to do it.
I love that. I love that. Let's say you're there for 20 years or 20 plus years.
Yep.
What came after that?
So
First of all, how do you leave that?
Yeah,
So
every
there's that.
time I said I'm going to leave,
It's a lifetime.
Yeah, it's true. Every time I said I was going to leave, something else came up,
Yeah.
and there was other opportunities. It's a huge place.
Oh, yeah.
It's a place that you have so many different avenues you can go down. But my wife and I are expecting our first child, and we said we wanted to be closer to family. Well, they couldn't bring family closer, so we moved out to Salt Lake City area, and I worked with Blue Cross Blue Shield plan out there. We had offices in 4 or 5 different states, and my role was to transform training within that organization.
Wow.
I stayed there for a couple of years because we realized, well, we can be closer to both families if we move toward the center of the U.S., and then we moved to Nashville. I stayed within healthcare. Had a bigger calling when it came to.
A lot of healthcare in Nashville.
It's true.
Oh,
It's
my
true. We
goodness.
have Vanderbilt, and then the company I work for is called HealthSpring, and they were since bought out by Cigna. But
Yep.
HealthSpring as an organization is really focused on the Medicare, Medicaid population. So usually they're underserved to
Right.
where a Medicare individual has possibly anywhere between 9 and 11 different medications that they have to take. And the average of 6 minutes per doctor's visits just wasn't enough.
Right.
So when HealthSpring was growing and coming up, they opened up offices in local areas to where the time spent in the office with the doctor with each of those was about 20, 30 minutes. So you can ask your questions, you can get to know your doctor.
Yeah, right.
And the doctor wasn't forced to see many, many patients at the same time.
Right.
And they were able to spend the time with the
That's
individuals.
quality.
Yeah, and that's 6 minutes a visit. You're killing
Correct.
a lot of people,
Yes.
potentially.
Yeah.
Well,
the challenge is that with the meds, you can't ask as many
ask your
questions as you
questions,
can.
yeah.
Exactly. And there's
Well-
no rapport.
It's almost a one way.
Yeah.
I'm looking at data. Okay, here's what we got to do. Boom, and the patient's not got enough time to then say, "I've got this question, or I've got this concern. What about this, etc."
Exactly. And when we would go into the doctor's office and look for the groups to partner with, what we would ask them is we're introducing an electronic medical record system, an EMR.
Right.
So how do you handle that? What do you do now for your records? Most of them had papers
Oh,
right
yeah.
before the transition. So we had to teach them how to use an electronic medical record system, but keep the patient up front. So it was doctor-patient technology, not
Right.
doctor technology patient.
Right.
So we had to switch that. And it's a different mindset because as you're trying to learn something, you want to focus in on what you're learning. And for them, it was the technology.
Right.
We had to pull them away. So we had them talk to the patient, and then we would put somebody in the room to help them so that we would better understand the experience, but they would understand the important part is the individual within the room, not the technology. We'll help them with the technology. Once they got comfortable with it, they can see the trendings and they can
Right.
see where the patient was headed, but also provide the patient with a good summary of the details in the system so that they didn't have to guess on the next step.
Yeah. The transition from Disney to healthcare. One, which did you prefer? I'm assuming healthcare because you're still here.
Yeah.
Unless you just got stuck.
No.
Yeah, the funny thing is that I don't really have a preference. I like as long as there's a value to it.
Right.
And that was the difference. When I first started at Disney, there was always that excitement, that value.
You
Right.
seem values and vision oriented.
Exactly. And when I went into healthcare, I went into that and I said, okay, so there's a lot of values here, especially as we focus on that Medicare population.
Yeah.
And that was key.
You're changing lives, saving
Exactly.
lives.
Yeah.
And at some point, I said, okay, well, is healthcare really healthcare? And then I paused, and then I spent about 8 years in consulting from an automotive perspective. So I went to a company called Precision Dynamics International, and we would consult with our major automotive manufacturers in the U.S. We had Nissan and Infiniti. We had Mercedes-Benz and a handful of others. It was a very big change. It went from coaching and training doctors and nurses to training car salesmen.
Right.
If there's any bigger change, I'd love to hear it because it was night
That's
and
a
day
big
for
change.
me. Exactly. Exactly. What I also wanted smaller. You know, at the Walt Disney Company, they're a Fortune 100 company. When Cigna bought HealthSpring, we were within that Fortune 100 company itself. I said, you know, I want to take a step back to see how else we can make a difference for smaller groups. Automotive, while it was different, they learned the same. They want to be engaged, they want to grow, and they want to have different things.
Right.
It was probably one of the funnest roles that I had was within that group, because when we would consult with a client, they would say, well, make this engaging. And we started a field training program for the staff at Nissan and Infiniti, to where they would come and learn about the basic things as far as what they need to do for the job, but in a fun way.
Right.
We had an escape game that we put on in a hotel. We had fake walls to where we
that's
made
awesome.
it a laboratory. Yeah.
Things you can't do with doctors and nurses.
Exactly. Well, no, and you know, you can't bring them along for that far. So the escape game concept just took off because we would use a financial statement. They knew the financial statements up and down, and then we would make the escape game about them identifying areas of the financial statement, and they would have to break out. They were so excited about that. We brought it back to the place that we would normally conduct our training, and we did smaller versions of that moving forward. But then we said, okay, so there's a better way to have this last longer. So we would do smaller events along the way, and we brought it to each of our other clients.
Theme that builds throughout all of this is it's audience specific, or
Yes.
your population that you serve. What do they need, and how do you need to deliver training that resonates with them?
Exactly. And you know, at some point, if you don't change with that, if you don't know where to adjust and how to listen, you're going to lose your audience.
100%.
And the answer to all of these satisfaction surveys is, this is a smiley sheet. Well, I love the trainers, but the content fell flat.
Right.
And it has to be a combination of both. You have to engage them. You have to have some type of excitement there, because if you don't, they're not going to use it. So if they don't use it, they're going to come back for something else, and then they're going to wonder, you know, what's happening. How do we do this again?
So how long have you been with Orlando Health? You've been there 3 years?
3 years, yeah. So at some point in the automotive, I said, well, we've done everything we can here. And I moved from Nashville back down to Florida. So we were here for a few years, and I said, I'd like something local. Our children were getting older. They're now both in college. And I didn't want to miss some of that again. So I went to Orlando Health, took that 3-month break, and then I said, hey, I can do more. How can I help? And you know, it took off from there. I got one team, and then I got another, and then another.
That's what happens.
That's
true.
like somebody who retires
Yes.
for a day.
Battlefield promotions. And again, you brought this on yourself.
I did.
To
I
some
Oh,
did have
degree.
nobody to blame. Yes.
We're going to let you know you brought it on yourself.
Now,
Exactly.
was Orlando Health, were they already a Cornerstone customer?
They were. They've been a Cornerstone customer since I believe since 2013. So,
Okay.
Yeah.
Or a little bit over a decade.
Correct. Yeah.
So, you know, here at Connect, we've been hearing a lot about workforce agility. So when someone says that to you, first of all, when Cornerstone says that to you, et cetera, what do you think? And how do you convey that to other people?
Yeah, I think of all the things that we just talked about, because
Right.
each of those points to where in my career you look for the adjustments. If we weren't able to go from those CDs to an e-learning course and wait for it to render for 2 days, you lost.
Right.
And you had to figure out a different way to do it. So now, you know, we talk about microlearning. We talk about smaller chunks because, you know, with our technology these days, everybody's browsing TikTok, YouTube's, you know, even different. So, you know, you have to keep scrolling. So we've had to adjust for that. And that's what we're looking even for Cornerstone or any system to do is, how do we take all of this content, boil it down, but also do it in a way to where it engages learners and they want to come back and they're asking us for different types of things.
Right. I love that.
So what are you looking forward now in, let's say, the next, I don't know what the shelf life is, 18 months, 24 months in learning? What are you looking at as the next step for your teams in learning? How do you continue to grow?
I think a big part is really listening to where the learners are going, not where they've been.
Right.
You know, it's that Wayne Is that Wayne Gretzky that said,
Oh, yeah.
don't skate to where the puck has been, go to where it's going? That's exactly what it is for us.
Yeah.
We want to make sure that we're listening, but we're also impacting our patients at the same time, so that it's not just about training somebody to do their job. It's about somebody to make a difference when they come in to visit any of our hospitals or healthcare centers. We don't want them to have a normal experience. We want them to have an extraordinary experience to where they're thankful for being there, and then we provide that. That training helps with that. From a learning perspective, the micro-learning piece has to get a little bit better, because what it has to do is the same thing the escape games did. The escape games really engaged the learners, but then they started to apply it in their job and started to talk about it later. Microlearning has to do the same thing.
Yeah. Do you, and you'll probably have a thought on this as well, is it adoption of the learning or is it application of the learning?
For me, it's more application, because the adoption comes with just understanding as you're taking it, and you'll morph into understanding why you're doing it. But the application of it is where the measurement comes in, and we can see where it makes a difference. Back in the day, when we first started measuring application, even at Disney, what we saw is that about a third of the leaders were saying, well, the team members or the cast members were doing what they needed to do. But 2/3 of the cast members were saying they did the same thing. So it's about reinforcement. As we look at it now, that adoption has to kind of take off, and application has to take off a little bit more, because while they're coming in maybe with less skills, what we're seeing is that they're welcoming the skills that they're building.
Right.
But we need to have a path to keep them there, so we don't lose them to another company.
Yeah.
Yep.
So last question for me is something that a lot of healthcare establishments kind of focus on is patient satisfaction. So is there some linkage between what you do and patient satisfaction?
There is. In fact, we have an initiative now that focuses on our HCAP scores, and we center it around our 4 key behaviors. And it's important for us because what we've tried to do is that if we try to do it separately to where patient satisfaction is its own thing, we don't connect it.
Right.
So when we started to connect it back to the 4 key behaviors and how important learning is, what we see is good momentum. And we see our HCAP scores go up. We see our patient satisfaction experiences go up. And then we make sure that we loop back with the teams to do that. Because when they don't realize that it's making an impact, it's why am I doing it?
Yeah.
Now they're seeing it. And we're making sure that they understand that by embracing those 4 key behaviors, by making sure that they do their job not only well, but extraordinary, then they make the difference for the patients.
Final question for me, and it's just to build on this previous, is the success, the impact that the teams make when you show them when you recognize them for making the impact, do you need to tie that back to compensation, or is it just the impact is good enough for them?
You know, the interesting thing is that the push is more of that self-satisfaction at times.
Right.
Now, we as an organization like to take a look at how we do, because if we're doing better, we balance it out with our team.
Sure.
Right.
They feel that, but they also feel valued. So when we turn it back around, hey, this is making a difference, they're more willing to do it again and do it better the next time. So that engagement is important. Compensation kind of comes along with it. If we do the right thing from a business perspective, we march to that path.
Especially if you've connected the why.
Exactly.
So that they understand, okay, this is why we're learning, and this is how it impacts the business, etc.
Exactly. Yep.
Thank you so much, John. This has been absolutely fantastic.
Thank you. I appreciate your time. Thank you.
And we appreciate your time.